Let's walk through our 4-position exam maneuver. Lay the baby on the exam table in the supine position. Next is the pull to sit maneuver. Pull the baby to a seated position from supine positioning. Newborns and 1-month-olds will require some head and neck support during the pull to sit maneuver. The 3rd position is horizontal suspension. You will lift the baby and hold the baby above the exam table. The last position is prone. Gently place the baby onto the exam table on their tummy and observe the baby's movements. First, we will take a look at a newborn to 1-month-old baby that is typically developing. In the supine position, you can see that the baby is able to regard faces from about 8 to 10 inches away. The baby's elbows, hips, and knees are in a flexed rather than extended posture, although extremities can be slightly extended while the baby is in a resting state. Finally, the baby's hips are slightly flexed but can flex and extend. What you see here can also be used as a guide during the newborn visit, although a newborn infant may exhibit less core and neck tone and spend more time in flexion than a typically developing 1-month-old baby. In this clip, you will see another newborn to 1-month-old baby in the supine position. However, this baby displays features of atypical motor development. As you watch this baby move, I will point out some of the atypical features to watch for. This baby's extremities are limp and extended even when in a more active state. Overall, this baby has a flat on the mat appearance, which is reflective of low tone and possible weakness. It is important to take note that this baby's hips are abducted nearly to the mat rather than held flexed. In severe cases, the lateral aspect of the knee can even touch the mat. These exam features should raise some red flags. When looking at a newborn to 1-month-old baby during the pull to sit technique, it is typical for there to be some head lag requiring some neck support during this maneuver, but you may see that the baby is putting in some effort. Around 1 month of age, the baby should still require some support during this maneuver, but will have more neck flexion during this technique. When you are pulling the baby upright, you should feel some resistance as the baby flexes its neck and arms, putting in effort to counter the pull to sit movement. When the baby is in the sitting position, the baby will still require some neck support, but the head should be able to come to the upright position for at least a few seconds before dropping forward or backward. The baby's arm should remain partially flexed at the elbow during this movement, and you should see that the baby tries to hold the trunk straight and upright throughout. Some atypical features that you should look out for in a newborn to 1-month-old who is being pulled to a seated position are significant head lag and no effort from the baby to flex the neck or to counter the pull. You can see that the baby's arms are fully extended with no flexion, so there is no pulling or resistance with traction. The baby's head doesn't remain in the upright position, even briefly, in the sitting position. A distinguishing feature of atypical motor development in this position is considerable rounding of the spine and an inability to remain in an upright posture. It is typical for a newborn baby to require some support to keep the head, neck, and back in the same plane during horizontal suspension. The baby's extremities should maintain some flexion even in this anti-gravity position. The hips and trunk should also show some resistance to gravity in this position and should not be draped over the examiner's hands. Features of a newborn that is showing signs of atypical development include extreme lack of neck extension, such that the baby may even have their head resting on their chest if not supported. The baby may not demonstrate any tone or effort to straighten the neck and back in this position. There is no flexion in the extremities, and the arms and legs are dangling and extended. There is no anti-gravity tone present in the hips, and the trunk and spine are rounded. This typically developing newborn to 1-month-old baby will slightly lift their head and neck off the table for brief periods of time in the prone position. The baby turns their face to the side to move their mouth off of the mat. The baby maintains some flexion tone at the elbows and the knees. The baby's hips are flexed and adducted, so the baby's bottom is slightly elevated off the table. A baby that demonstrates atypical development will not attempt to lift their face or mouth off of the table or turn their face from side to side. The baby appears to have a flat on the mat appearance. The baby's pelvis is flat on the table and shows no elevation. Some non-motor milestones typical of this age group include fixing eyes on faces, soothing with touch, making gurgling sounds, and turning their head toward sounds. Let's review some of the red flags for this age.
There are several red flags to look for in a newborn to 1 month exam. These include does not regard faces consistently, no flexion in extremities. In fact, the extremities are limp and extended during active times. The baby has a flat on the mat appearance and the body is in a limp C shape when lifted. Poor feeding or exhaustion with feeding, and doesn't respond to sounds or turn their head towards sounds.